Hello, Dr. Andrea Schnowske from Freedom Chiropractic and Holistic Health in the Peoria Metro Center and our YouTube channel, Health and Horsepower. This Wellness Wednesday, I want to talk a little bit more about how digestion impacts your joint health. I don't know if a lot of people realize that what you eat and how you digest it actually impacts whether or not your joints are able to repair and stay strong so you can age gracefully and hopefully prevent arthritis and other joint conditions. So it's really important to understand that your stomach has a mucin protective coating inside of it that not only protects the stomach from irritation, stomach pain, and heartburn, but also is responsible for producing the stomach acid that your body needs to break down proteins and amino acids and also your other foods that you're eating. So anytime that we are eating a food, our stomach acid has to break down the proteins and has to break down any of the starches, any of the carbohydrates, any of the fats, so that our body can break that into small chunks that are then usable and able for our body to build into other things. So protein, I know we talked about collagen previously, but protein really is a building block that breaks down into amino acids. And those make up not only your DNA, they actually make up your ligaments, they make up your cartilage, they make up the protective coating of your joints. They also make up the muscles and ligaments that hold everything together and keep your joints stable as you age. As we age, there are some normal processes that happen. So as we age, we do lose the amount of stomach acid that is produced, which means that as you age, you may need to do smaller meals throughout the day with very small quantities of protein at a time so that your body's stomach acid is able to break those down. However, if we have chronic health conditions or we've had malabsorption or digestive issues for a long time, we may actually have a dysfunction going on where our stomach lining, that mucin lining inside of our stomach that coats and protects and produces your acid, actually can thin out. And then we don't produce a strong enough acid to break down our food. And what tends to happen is if you're not producing a strong enough acid in your stomach, your body cannot break down proteins and fats. And sometimes even we can have issues with carbohydrates and starches and things like that too. But typically proteins and fats need to be broken down for proper skin, joint, and muscle and like connective tissue health. So if you are having symptoms of heartburn or stomach pain after you eat a meal, I would say probably within the first hour where you're having negative symptoms of digestion, you may have an issue going on where your stomach does not have a thick enough mucin lining, does not have the proper or the strong enough stomach acid being produced to help you digest things. Now I know a lot of you are going, wait a minute. I have heartburn because I have too much acid. Actually, in the past 15 years, a lot of our research has shown the exact opposite. We actually have a high pH, which means not effective stomach acid, and sometimes we don't have enough being produced. So what happens is when you eat a food, that food basically sits in your stomach. It's not getting broken down quick enough, so the food usually is sitting there putrefying, which can release gas and irritate your stomach lining. That can cause not only stomach pain and burning, it can also cause you to have frequent burping up. So if you're burping very frequently, especially if you are getting more of like reflux where you're actually coming up with food at the same time, or GERD, that's a symptom that you have usually a hypochlorhydria, so low or weak stomach acid going on. Like I said, some of that is normal with age. However, if we have other health issues going on, sometimes that is way beyond what's normal, and that can cause major issues where your body is not breaking down proteins and fats sufficiently, and that can cause issues where basically your joints are not getting the proteins and the fats to help them restore and regenerate. And we can see not only our joints break down faster, but the connective tissue around them becomes more brittle. So we have much more stiffness, we have much more mobility issues, we can have much more pain because that connective tissue is not being rebuilt, regenerated when we injure our joints, and your body cannot heal properly. Another thing to keep in mind is some of those healthy fats that you're eating in your diet. If you can't break them down properly, those healthy fats actually help to build up the fatty layer in your skin. So a lot of times we'll see thinning skin. So you may notice that your skin starts to kind of sag or wrinkle, or sometimes we can even get more of like a crepey feeling to our skin when we're losing that fatty layer. That same fat, the healthy fats that I mentioned, also coat every single nerve in your body. So if you are having neuropathy issues. If you're having issues with numbness and tingling, or you have issues with nerve compression or disc bulges, there's a chance that you may be losing the connective tissue to give structure and stability to the joint, but also that protective coating on your joint that's going to protect those nerves from being irritated very easily. And that can cause your pain levels to go up. That can cause more symptoms of neuropathy. So if you're having digestive issues, or you're having symptoms of heartburn or stomach pain or reflux or frequent burping, that may be a sign you have a digestive issue going on that could be impacting not only your digestive or your joint health, it could be impacting your actual bone structure and also your nerve response. So if you're having a lot of nerve pain, especially if you're having some of those digestive symptoms, it may be time to talk to somebody that does more functional type of healthcare, like I do in my office. A lot of times medical doctors, if you're having symptoms of heartburn, will give you an antacid like omeprazole. They may give you like a Tagamet or something like that. Basically, those kind of stop and interfere with normal, like your acid production. So that can cause, yes, some symptom relief, but it doesn't fix the problem in the long term. And those have some serious side effects if you take them in the long term. So typically in my office, I focus on figuring out what do we need to do to regrow that mucin layer? What do we need? Do we need to add a stomach acid or like a digestive enzyme to help you break down your food in the meantime? And sometimes if you've had that issue going on for quite a while, we may also need to focus on healing the lining inside of your intestine in addition to your stomach. So if you need help, feel free to reach out to my office. I am more than happy to sit down with you, talking more about how that process works and what we can do to help you in our office. So hopefully you learned something today. Have a great day.